Good morning, everybody. I don't even know where to begin with this. There's so much to talk about, but I'm going to make this video on one subject and one subject only. Rep. Steve Scalise tweeted this. Now, if you don't want to hear me read it, because I'm going to do a lot of reading here, just go find his tweet and read it yourself. But if you need somebody to put you to sleep tonight, and you could save this video for bedtime, do that. Here's the tweet. Just sent letters to the Democrat governors of New York, New Jersey, California, Pennsylvania, and Michigan demanding they explain why they ignored protocols and forced COVID-19 patients into nursing homes. The outcome was devastating. Families who lost loved ones deserve answers. This tragedy was avoidable. I know I read like a third grader. What could I do with it? The print is this big on this stupid thing. But what else does the tweet have? The tweet has the actual letter he sent to Governor Cuomo. Let's read. All right, come on, open up. Oh my God, can I make this bigger? Not really. What the fuck? All right, the Honorable Andrew M. Cuomo, Governor of New York, blah, blah, blah. Dear Governor Cuomo, the ongoing COVID-19 pandemic has disproportionately affected the elderly, especially those living in nursing homes and other long-term care facilities. We write seeking information on a granular level about the science and information used to inform your decision to mandate nursing homes and long-term care facilities admit untested and contagious COVID-19 patients from hospitals. This decision likely contributed to the thousands of elderly deaths in New York State. Thank you for your attention and prompt response to this important inquiry. The week goes on. On March 13, 2020, the Center for Medicare and Medical Services, CMS, issued guidance for infection control and prevention of coronavirus disease 2019, COVID-19, in nursing homes. This guidance is a blueprint for individual states to follow when determining how to best control outbreaks of COVID-19 in nursing homes and long-term care facilities. This guidance does not direct any nursing home to accept a COVID-19 positive patient if they are unable to do so safely. In fact, it says nursing homes should admit any individual that they would normally admit to their facility, including individuals from hospitals where a case of COVID-19 is present, only if the nursing home can follow Centers for Disease Control quarantining guidance. CMS Administrator Selma Verma said, under no circumstances should a hospital discharge a patient to a nursing home that is not prepared to take care of those patients' needs. CMS did not mandate COVID-19 positive patients back to nursing homes, but instead stated that a COVID-19 case at a hospital does not preclude the nursing home from accepting a COVID-19 negative patient. There's more. On March 25, 2020, the New York Department of Health issued on their website a now deleted, if it wasn't bad, why'd you delete it? Let me read this again. On March 25, 2020, the New York Department of Health issued on their website a now deleted directive on hospital discharges and admissions to nursing home. This directive said, no resident shall be denied readmission or admission to the nursing home solely based on a confirmed or suspected diagnosis of COVID-19. And nursing homes are prohibited from acquiring a hospitalized resident who is determined medically stable to be tested from COVID-19 prior to admission or readmission. For clarity, this advisory mandated nursing homes accept known COVID-19 positive patients and further mandated that nursing homes not even test patients for COVID-19 prior to admission. Uh-oh. According to the most recent available data, New York has suffered 6,360 nursing home deaths related to COVID-19. That is more than 25% of the state's total COVID-19 deaths and more than 4% of the state's entire nursing home population. New York did something a little crafty. If you were a nursing home patient and you were hospitalized and then died of COVID-19 in the hospital, You were not counted as a nursing home death. Did you know that? I bet you didn't. Okay, we're going to get into that. According to the most recent available data, blah, 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 blah. Okay. To help us better understand what science or guidance you use to mandate this lethal decision, we respectively request the following documents and information. 1. All state-issued guidance, directives, advisories, and executive orders regarding hospital discharge to nursing homes or any and all other types of assisted living facilities, including those previously superseded in chronological order. 2. The total number of COVID-19 related nursing home deaths, including deaths that occurred at the nursing home and deaths of a registered nursing home patient at a hospital, by day between January 1st, 2020 and present. 3. The total number of COVID-19 related nursing home positive cases, including individuals who tested positive at a nursing home and individuals who tested positive at a hospital, by date between January 1st, 2020 and present. The total number of confirmed or suspected COVID-19 positive patients returned to a nursing home or other long-term care facilities between March 25th, 2020 and present. That's the time of the directive. All information, documents, and communications between the Office of the Governor and the New York State Department of Health regarding COVID-19 mitigation in nursing homes and other long-term care facilities. 6. All information, documents, and communications between the New York State Department of Health and any of the state's nursing home administrators. Oh, there's a third page. In addition to these documents, please provide a staff-level briefing no later than June 18, 2020. That's today. This briefing may be conducted remotely for convenience and safety issues. To schedule the briefing or ask any of the follow-ups or related questions, please contact Committee on Oversight and Reform staff at, and it gives a phone number. The Committee on Oversight and Reform is a principal oversight committee of the U.S. House of Representatives that has broad authority to investigate any matter at any time under House Rule X. Further, the Select Committee on the Coronavirus Crisis is empowered to investigate preparedness for and response to the coronavirus crisis, including the planning for and implementing of testing, containment, mitigation, mitigation, and surveillance activities. Thank you in advance for your cooperation with this inquiry. I have a feeling you're not going to get much cooperation. And then sincerely, Rep. Steve Scalise, Rep. Jim Jordan, Rep. Blaine Left, I can't pronounce that name, Rep. Jackie Walorski, and Rep. Mark Green, MD. Ooh, we got an MD in there. Oh, man, it took me almost 8 minutes to read all that. Jesus Christ. Sorry this was so long. I thought you might like to know. Bye.